with another AMC Connects, and we hope you've enjoyed some of the modifications that we've made in the last several weeks and episodes, given some of the feedback from our workforce. Thank you as always. This week, we have, some feedback from somebody, right, Chuck?
Yeah.
This is nice. If you remember, I think it was now 3 weeks ago, we did announce that we had been reviewing our first 6 months on our podcast in AMC Connects. And there were a set of themes that people had shared where they kind of started with, I like AMC Connects, and then they left it open. Or, AnneMarie, you seem really nice. And then they left it open, which is good, but not great yet. And the leaving open, there were many people through a variety of different formats that shared within the network that we didn't, as a workforce, had everything we needed, tools and resources to be able to do our work in the exceptional way we all expect ourselves. So over the last several weeks, we've been working on some of those items that we talked about on a previous episode, and lots more to come on that. We'll get back to that on another episode. But before and without further ado, this particular set of feedback just made me laugh. I don't know about all of you, but do you ever read something, see an email or a text where you're not even all the way through it and you just have an outburst of laugh? I mean,
that's and a big smile, just a smile. You're smiling.
I mean, that's where the whole LOL comes from, which is really overused now, I know, but I did literally laugh out loud. There is a workforce member who has announced themselves as a super fan.
Woo!
And yes, giving us some feedback anonymously, and did share that I was too embarrassed to send it to the mailbag, but I just realized that AMC Connects stands for AnneMarie Czyz. I love that because, one, I can relate to it. Sometimes when people are trying to do some innovative things where they draw connections and subliminal messages, it takes me a bit too. So for this particular fan and viewer, I can relate to that in particular. But yes, AMC Connects does stand for AnneMarie Czyz.
I want to know what triggered it though. Like, what was it that we said or did for this person to be like, oh, like it all connected?
Well, let me go on a little bit, Chuck.
Okay.
And maybe it's here somewhere, but we haven't seen it yet. But wow, with an exclamation point, I'm slow. I've certainly felt that way. As always, I love AMC Connects and the special editions. They're great, and more importantly, amazing topics that I can always connect to. Thank you for doing them, and I'm sorry it took me 6 months to figure out what AMC stood for, with an exclamation points and smiley face. Anonymous worker that really enjoys the weekly episodes. Hashtag AMC Superfan. Oh, thank you. Thank you for taking the time to admit that, to share it. And of course, Chuck and I getting the overwhelming amount of feedback we're getting for how we're doing on the podcast. It was nice to be able to have this one as well. And again, can totally relate to it. I do have, like many people who are getting older and on in their years, I do have a couple names. So I'll expound on that a little bit, because AMC, like there was AMC Root Beer, right, Chuck? That was like a good root beer in the past. I think there's an AMC
there's a TV station. That's the big thing. That's the hardest thing, because you got to be at a TV station.
Yes, so that's a little bit distracting. Did people think back to Chuck's why? Did people think there was a connection there? And isn't there a fast food restaurant? AMC? I might be making that up.
Is that a bowling thing? Is AMC a bowling thing? Or no, that's AM. I don't know.
See,
we're making things up. Let's go.
We're making things up because I can be self-absorbed a time or two. But I do have a couple names out there, and one of them is AnneMarie Czyz, and another is I was previously Anne-Marie Walker. And so there's names out there. If somebody's Googled, you get all kinds of information. But thank you to the superfan for watching the episodes, giving us some feedback that you're liking the topics and the changes. And I'm so glad for you. And now we've announced it to anyone else who might be like, what is this? Yes, it is my name, AnneMarie Czyz Connects. And kind of the statement in there, of course, is that working hard to connect with all of you. First and foremost, our workforce, because our people are everything. Our people, all of you, are what inhabits and provides the picture of our mission, vision, and values and what we're working to do here at Realm Health. And certainly, as we announced many months ago, we're opening it up to other social media channels. And so we have a number of community members who are devoted to listening or viewing the podcast. And we're really grateful for all of them as well, because they've given feedback that's been able to shape us. I hope you all enjoyed last week's episode. It was a little longer than we were targeting over the next 6 months, but we really felt that it went quickly because this concept of AI, this artificial intelligence topic, is pretty wide and broad and deep. And hearing from Dr. Attilio was just really helpful, and he's spending a great deal of his time on it. So if you didn't see it, please tune in. We're really grateful for his time and his effort that he's spending on helping us understand AI. Well, without further ado, we have a great guest with us. Maree Joy is her name, and she is our very first advanced practice nurse that's been on AMC Connects. Maree Joy, thank you for being with us.
Yes, thank you for having me.
Yes, and so I said advanced practice nurse, but you are licensed as a nurse practitioner, of course, within our pediatric office.
Yep.
Okay.
Yeah.
And have you only ever done pediatrics and that's what you're licensed, or did you do like a family track and then specialize in pediatrics?
So I've always done pediatrics, and I actually went to Upstate Medical University for my pediatric nurse practitioner degree. So I am solely pediatrics.
Oh, great. Now, did you work as a nurse in pediatrics before you decided to be an advanced practice nurse?
I did. Yep.
Okay.
I worked at St. Luke's Hospital back in the day,
Nice.
before it became MVHS and WIN now. So I worked on the pediatric floor there and got some experience, and I loved it. I always knew that pediatrics was where I was going to be.
Oh, don't you appreciate that connection?
Oh, yeah. Yep.
Okay, so before you went into nursing, you didn't know that pediatrics was going to be your place, or did you have an idea?
I kind of had an idea, but then when I started, so I actually started as a nurse's aide or a care attendant before I became a nurse on that same floor. And that's really what sold it for me, was seeing the kids and just knowing, like, you know, I can make a big difference. And kids, they're just so resilient.
Yeah.
They're so honest.
Yes.
And you get to watch them just evolve and grow. And I think that's what I love the most. Yeah.
Oh, that's so great.
I loved it. Yeah.
That's great. And where did you go to nursing school?
St. Elizabeth's College of
Nice.
Nursing. So,
Great.
yeah.
Great graduates coming out of that program.
Oh, yeah.
Yeah, so blessed to have
Great
you.
school.
Did you know that you always wanted to be a nurse?
I did.
Okay.
Yep. From as far as I can remember when I was very little.
Was there any trigger or like exposure that you had?
I don't think so.
Okay.
No one in my family is really in healthcare. So I was one of the first to go into healthcare and become a nurse. So yeah, I think I always just loved taking care of people.
Yeah.
And it's very like rewarding to me. So
You had that heart.
yes. Yeah.
And so before you went to nursing school, you said you were like a care tech. as
Yeah.
well. Okay. So you had that exposure first.
Yep. So I worked as a care attendant or a nurse's aide for about 2 years in nursing school. Then became a nurse on that same floor. Then went right on to become a nurse practitioner because I knew I wanted to continue in this pediatric field. And knowing that Upstate had the program for pediatric NPs, I knew that's exactly where I was going to go.
Congratulations.
Thank you.
It seemed like from what you're sharing, like the more exposure you had, the more you could see that your path was lighting up.
Yeah. Oh, definitely.
That's great.
Yeah.
I ask some of these questions because, as you know, we do have a lot of members of our team, our clinical team, that have different degrees or they have different starting points. What helped you know that you could do it? Because we have nursing assistants or patient care techs. And as I talk to some members of our workforce in those roles, some absolutely love where they are, and that's great. We're so thankful for that. And others are like exploring, should I or do I want to do something different or go to nursing school or something else?
Yeah. I think I will say I do miss like the bedside nursing. I do miss that aspect of it, but I feel like the more that I did it, the more rewarding it was. And I was like, I could make even more of a difference on the provider side. So I felt like that was like the best of both worlds where, I'm still working with kids, but I have a little bit more, say, and I have a little bit more, hands-on, I guess, opportunities in their care.
You're right.
Yeah.
You like create the care plan.
Yes,
in addition to-
exactly.
yeah, just
Yeah.
following it.
Yeah.
Okay, so Rome Health Pediatrics, how long have you been with us?
I started in January of 2026.
Wow.
So it's been a little over half a year now.
Mm-hmm.
I've been practicing over 6 years now. Or I just hit my 6-year mark recently, I should say.
Congratulations.
Yes, thank you.
So they say in the literature, if we've been practicing for over 5 years, we're an expert. Do you feel like
Right. I want to say expert. I feel, there's always room to grow and to learn, and no one knows everything by any means. And I love learning new things and expanding on what I already know.
Thank goodness. Yeah.
So it's nice to know that that's what the literature says, like the 5 years.
So if you weren't feeling confident, I was going to insert that right in there for you.
Well, thank you.
So, yes, because we have heard wonderful feedback about the care that you provide at the clinic. I mean, yes,
That's good to hear.
we haven't had a chance to sit down and get to know each
I know,
other, so
yeah.
this is very exciting for me.
Love it.
But your reputation precedes you.
Oh, thank you.
Why do you think that is? What's your approach to caring for? Because when you're caring for a child, it's really more than caring just for that child, right?
100%.
Oh, it's like you have quite a few other patients.
Yeah, yeah. It's the whole family,
Yeah.
and sometimes you have grandparents and siblings in the room, and you got to really just, my biggest thing is making everyone feel comfortable.
Yeah.
I will take as much time as I need to explain something and make parents, answer any questions they have, make them feel comfortable, and let them know, like, they have this, they can do this. Again, we're all human, we all make mistakes, and we're all learning as we go, and I feel like that's my MO, that's, we're all, learning as we go. And,
Yeah. And in it together.
Exactly.
Right. Oh, I really appreciate that. Many of us were first-time parents or parents going through different stages that felt like that we made mistakes. So I really appreciate you saying that. Just made me feel better, Maree Joy, that my children are older, like much older now, but that we make mistakes, and to be able to have a healthcare professional that you can talk to about what might be going on. It sounds like you're very open to that and not judgmental.
Nope, there's no judgment at all coming from my end ever.
Yeah.
So I want everyone to feel comfortable, and I feel like they could ask me anything. There's never a stupid question.
That's great.
Never.
Well, I was just going to ask that. What, other than certainly like annual appointments or assessments for school and things like that, what in your practice brings the most visits in? Like, what would you say some of the common concerns or complaints or what's coming up in the last 6 months?
It definitely changes, like, depending what season we're in. When it comes to, like, sick visits or acute visits, this time of year we see a lot of, like, injuries from rough housing over the summer, tick bites, sunburns, things like that. A lot of, like, kids are out of school and a little bit more rough and tumble.
Right.
If you were to ask me this in the fall or the winter time, I would say colds, all the viruses going around, upper respiratory symptoms. Those are the biggest, I guess, the more common visits that we'll see that time of year. Newborns require a lot of care. So, and I love the newborns. They also round at the hospital too to see the new babies. So seeing them, we see them for their first visit after the discharge from the hospital, and we'll see them about a week or two later. So those do become pretty frequent visits. And then, again at 2 months and 4 months. And so those are frequent ones too.
Yeah. What do you advise individuals, because we're hearing more and more about tick bites, what do you advise families and little ones about if they do believe they have a tick bite, or prevention and or treatment after the fact, I guess?
That's a good question. Yeah. Prevention is huge. So having protective clothing on, I almost said sunscreen, but bug spray, so have that option too. And then checking their skin each night, no matter how long they were outside. Try to make that a routine before bed or with bath time, that we are checking all of their skin to be safe, because ticks are so prevalent where we live, and it just happens so fast. And oftentimes the kid, they don't know. They don't know what's on. And always check, behind the ears and the ear folds, hair. Those are common areas where you just don't always think to, like, inspect so thoroughly. So it can go missed.
Okay.
And the second that you do find that tick, we say try to remove it with tweezers. They make some really nice tick removal tools on Amazon and online that you can buy.
Great.
They make it just like a little bit easier. I always carry one in my wallet, just in case, because again, you never know when you're going to find one. So try to remove it as soon as you notice it. And then especially if you don't know how long it's been on for, or it's very engorged, or there's a red ring going on around it, just call your pediatrician. Call us right away.
Okay. Don't wait.
Don't wait.
Don't try to figure it out yourself.
Exactly.
Okay. Great. And another question I had for you, which is kind of an age-old one, I remember it actually coming up in my nurse practitioner courses, which is a very long time ago, is the topic of vaccinations. What do you share families and children about the topic of vaccinations? How do you view that particular vaccination schedule or recommendations? How do you process all of that?
I stand by the CDC and AAP recommended vaccines. They are safe. They do not cause long-term harm, from what studies have shown. I am also very flexible when parents want to delay or change the vaccine schedule and do things a little bit differently. I am more than accommodating to do that. Or if they refuse vaccines, I do not say like, okay, see ya, but just I also make them informed of the risks of not receiving them or receiving them a little bit late or things like that. So I do stress them and I recommend them all the way.
Great.
But for families that don't feel comfortable or have their own beliefs and they don't want to, do the typical routine vaccine schedule, I'm totally okay with that too.
It sounds like you take such a patient-centered view.
Yeah.
Of your approach to care. Thank you
try
for
to.
that. Yeah,
of course.
Well, because there's so much information coming
There is.
at everybody, let
And
alone
it's scary and misleading. Yeah.
right. To be able to turn to you and have a conversation, especially if people are resistant or confused, that you take the time with them to walk them through that.
Definitely.
That's great.
That's huge.
Well, we have an amazing team in family medicine too. How do you enjoy the team that you're working with, and what are some of that?
100%.
Oh, good.
Yeah. It's myself, Maree Turner, another nurse practitioner, and then Dr. Cooper. I love it. It's a great team. We have great nurses and great staff. So yeah, I think just getting used to the office the first few months.
Yes.
That's the biggest thing, and I feel like I've adjusted pretty well and jumped right in, and I love it.
Congratulations.
Yeah,
Is there
thank you.
anything, I always try to ask this, is there anything that you think I could do that could help support the practice more to be able to, keep stress in the right place and be able to see our patients safely and efficiently?
I do wish we could have some more support staff some days. I know that's easier said than done.
Sure.
And having like a one-on-one like provider with nurse situation.
Got it.
I know we're working towards that. I think that's our end goal,
Yes.
last I heard.
Yes.
But I think that would make the biggest difference. And also for patients too, when the same nurse, grabs them or answers their call, and it's like they know they're getting consistent care in that same team.
Oh, yes.
We have a great team right now, but I do hope that we can have that consistency with, nurse and provider
That's great.
relationship. Yeah.
I will follow up on that with Sarah and a
Okay.
few others. Yeah,
Yeah.
I know that is the vision, but kind of how are we timing out to that so that you could depend on that, or certainly
Yeah.
our patients and families.
Yeah.
Great. Now, have you ever watched AMC Connects before?
A couple times briefly before this.
Oh, good.
Yeah.
Just before I was coming out.
I didn't know what to expect.
How did you like it?
I liked it. Yeah.
Okay,
I think this is great. I've never worked somewhere where we had something like this, so this is wonderful.
Oh, I'm so
Yeah.
glad. Well, I'm so thankful you came on, and it's almost like a big mile marker for us because nurse practitioners or APPs are incredibly important to our organization's network. So I'm a little remiss, Chuck, and everyone else, that it's been this long since we've had a nurse practitioner on. So thank you so much for being with us.
Thanks for
And
having
I
me.
don't know, because I did get this idea. Well, Chuck helped me get this idea from nurses. So you get a little token when you are on AMC Connects.
Okay.
Yes, and I got that. We got that
thank
idea
you.
from. You're so sweet. We got that from nurses who like to decorate water bottles, and I didn't know that was a cool thing. And so when you get to be a guest on the show, that we make sure we have a little token.
Aw.
So.
I love it.
Thank you very
Yes.
much, Maree Joy, for all that you do for the community and for having this discussion with us. We really appreciate it.
Thank you. Thanks for having me.
Of course.
Yeah.
Well, thanks everybody. If you are one that is in need of seeing a pediatrician or pediatric provider, we do have a great center, as you heard from Maree Joy. We're very excited for the work that's been done. We know that the needs sometimes are a bit overwhelming, so of course we have additional relationships in the community, but we're so thankful for all the specialty services that we have throughout the network. Thank you to you all, and a special thanks to our nurse practitioners and APPs out there who provide the best care out there here.